All right, welcome everybody to KSB's educational series. We got a great program tonight. Tonight is Understanding Medicare with Jason Brusky. So any questions and comments, feel free to leave them in the comment section below. I'll make sure to get them to Jason at the end of the program so we can get those answered for you. So no further ado, we'll pass it on to Jason and have a good evening.
Good evening. Thanks for joining me. As Aaron said, my name is Jason Brusky. I'm an RN, over 25 years of being a nurse, and I'm also the hospital's patient navigator. Tonight's presentation is mainly to help gear you into understanding how Medicare works. One of the reasons I decided to learn to do this is I learned many patients I found were struggling understanding how Medicare worked, or what was covered by Medicare, or what Medicare actually covered. So as I was trying to help them figure it out, I learned there was a lot of information out there that isn't always as clear as you think. Basically, Medicare has lots of letters, so I also felt it was kind of like staying afloat in alphabet soup. And I'm going to help you get through the alphabet so you have a better understanding of what you're going to do moving forward. Basically, to get Medicare, most people in the United States are 65 and older. Younger people with disabilities and have been entitled to Social Security benefits or a Railroad Retirement Board disability benefit for 24 months may also get Medicare. ALS patients can get Medicare benefits beginning the first day they get disability benefits, so they do not have to wait. A lot of patients with end-stage renal disease on dialysis or post-transplant also are Medicare eligible. Basically, there's two main parts of Medicare. Part A, which is commonly known as hospital insurance. It's premium free if you are over 65, or you and your spouse worked and paid Medicare taxes for at least 10 years or 40 quarters. If you did not put in a full 40 quarters worth of work, you may get it at a reduced premium. Cost of 2020 was $252 if you put in at least 30 quarters. If you are receiving the benefits from Social Security or Railroad Retirement Board, so you have to be eligible to get your benefits from Social Security or Railroad Retirement Board. Doesn't mean you filed for them, it just means you're eligible. If you and your spouse had Medicare covered government employment, you are also eligible. The previous slide, those people who are under 65 who can get Medicare also can get Part A at premium free. And if you and your spouse or your spouse did not pay Medicare taxes while working, but you're still a US citizen or permanent resident and 65, you may be able to buy Part A at a cost up to $458 in 2020. Medicare.gov as payment calculators for Part A if you are one of those that has to pay for Part A. Basically, how it works, it's a hospital coverage. So when you're admitted to the hospital, you have a $1,408 deductible in 2020. So if you are admitted as an inpatient, a hospital stay would cost you at least $1,408. After that, it pays 100% of your hospital cost up to the first 60 days of a benefit period. If the benefit period goes longer than 60 days, you will have a copay of $352 per day for those days between 61 and 90. And if you happen to be in there over 90 days, it goes up to where you will pay $704. And those are called lifetime reserve days, and you only have 60 of those. Once you've used up all your lifetime reserve days, you do become responsible for all the costs of that hospital stay. Benefit periods, they actually begin the day you're admitted to a hospital as an inpatient or to a skilled nursing facility, and it ends the day you have been out of the hospital or a skilled nursing facility for 60 days in a row. And then if you happen to use your Medicare Part A benefit for mental health care in a psychiatric hospital, you have a lifetime benefit of 190 days. So basically, if you are in the hospital, you're in for 3 days, you should have a copay of $1,408. And you're discharged on day 3, you go home. 40 days later, you're back in the hospital and you're admitted as an inpatient, you're still in the same 60-day benefit period, so you do not have to pay that deductible again. However, let's say you're hospitalized in January and pay the deductible. You remain out of the hospital after discharge up until someday over 60 days later. So let's just say you come back in April, you're admitted again. You do have a deductible to pay again because that's 60 days in a row between those benefit periods lapsed. Now for Part A, for the skilled nursing facility, basically skilled nursing facility is a nursing home that can provide skilled services that Medicare will pay for. You have to have a 3-day qualifying inpatient hospital stay to qualify. And you must be admitted to that skilled nursing facility within 30 days of that hospital discharge. Or if you were in a skilled nursing facility under a skilled stay and went home and had to go back, you can still go if it's within 30 days of that. You have to have a skilled need. So you have to meet what Medicare has determined need of the skilled nursing services, skilled therapy, not just custodial care. In the nursing home, your first 1 through 20 days, if you still meet that skilled need, are paid at 100%. From days 21 through 100, you would pay $176 per day and Medicare would pick up the rest. If you happen to need a skilled stay for longer than 100 days, you then pick up the cost and you're not really eligible for a new benefit period until you've had 60 days of not having skilled services in a row. Skilled care means nursing and therapy that can only be safely and effectively performed by or under supervision of professionals or technical personnel. And if a facility knows they're not providing skilled services and continue to bill, they can get denied, and then they're going to try to get that money from you when Medicare denies it. So most facilities are very aware of when they're no longer providing skilled services. Other things Part A covers: long-term care hospitals, sometimes called subacute rehab hospitals. Van Mater in Rockford happens to be one of these. Very similar to hospital coverage, but your deductible and your copay cost are a little less. If you go to long-term care hospital within 60 days of a hospital discharge, they waive your deductible. So if you had a stroke, you're in our hospital for 3 days, and it was determined you needed to go to Van Mater for very intense rehab, you would not have to pay a second deductible because you already paid the deductible when you were in our hospital. Intermittent skilled home care is also covered under Part A. That's 100% covered. You must be homebound, meaning that it's difficult and taxing for you to leave the home, and you need the assistance of others, and you're primarily leaving for medical care. The agency that provides this service has to be Medicare certified for it to be covered, and you must have that continued need of those skilled services. Just having blood drawn does not constitute a skilled service under Medicare rules. Hospice care is the other benefit covered under Part A. Generally 100% covered for routine hospice care. There are some exceptions. You may have a co-payment up to $5 for each prescription drug or similar products for pain or symptom relief while you're at home. Some hospices pay for it and all of it, and some can charge up to $5 if they choose to. Medications not related to your hospice diagnosis are generally not covered under the hospice benefit, although you could still bill Part D if you have a Part D plan in that case. You may need to pay 5% of Medicare approved amount if you use the inpatient respite care benefit from hospice. We're going to move on to Part B, kind of known as medical insurance. If you want Part B, you have to pay for it. This is not a free premium. You can actually have Part A for free and decide not to pick up Part B. The monthly premium for Part B is deducted from your Social Security, railroad retirement, or civil service retirement check. And if you don't receive any of those payments and you still are eligible and want Part B, Medicare will send you a bill every 3 months. Income may lower or increase your premium. A single person with an income under $85,000 or $87,000, or a married couple that is under $174,000 have no added adjustment to the premium. So if you make $88,000 and you want Medicare Part B, you're going to pay a little bit more than the standard premium, and a couple would have to be $175,000. Medicare.gov has tables that actually will show you the cost based on income. You can also contact Social Security, and they will tell you the exact amount you are paying for Part B. The standard premium of Part B is actually set by Center of Medicare Services. This year it was $144.60. Most of the people in the United States who receive Social Security actually pay less than the standard premium. 2019, the standard premium was $135.50, and the average person paid only $130. There is a penalty to the premium if you do not sign up when you are first eligible, and that penalty can be up to 10% for every 12 months you had no coverage. So this year, if you chose not to get Part B and then a year goes by and you decide you want it, add 10% to the cost, so you're adding about $15 to your monthly premium because of the penalty. And if you go a second year without it, that could add even more. If you had other credible coverage and signed up within 8 months of losing it, that penalty is waived. I will explain some of that a little later. You get to pay the standard amount or higher if you enroll for the first time in 2019 or 20. You don't get Social Security benefits, or if you're directly billed for Part B premiums, you'll usually pay the standard amount or higher. If you have Medicare and Medicaid, you generally pay the standard premium, but the state will pay that premium for you. And modified adjusted gross income on your IRS tax return from 2 years ago, if it's above a certain amount, that could change how you get paid, how your Part B costs are. So if you sell a business and your income is really big one year, you better contact Social Security, or they're going to try to adjust your Part B premium for quite a few years. Part B coverage, when you have it, there is a deductible of $198. So Part B doesn't cover anything when you start the year, or if you became eligible in June, it doesn't start covering anything until you pay $198 out of your pocket. That deductible is set by the government and changes year to year. Once your deductible is met, Part B covers 80% of the Medicare approved amount for medically necessary services. Basically, there are services and supplies that are needed to diagnose or treat your medical condition and meet the accepted standards of a medical practice. That can include clinical research, ambulance services, durable medical equipment like walkers, wheelchairs, oxygen concentrators, mental health services, a second opinion before surgery, limited outpatient prescription drugs, such as if you choose to have a nebulized medication and you want to bill that through Part B instead of billing through your Part D plan, that is an option. A lot of medicines that are given in the doctor's office are billed under Part B. An observation stay in the hospital, so you do not meet inpatient criteria and you're there for observation. Example is you go to the ER with chest pain and they want to keep you overnight, check some labs, monitor your heart, make sure you're not having a heart attack. That almost never meets inpatient criteria, and that would be billed under observation. While you're in the hospital, hospitals can bill you for medications not related to why you're in observation, like your everyday home meds, but the hospital then could bill Part D, but most hospitals are not in your Part D network, so that may not be a cost-effective solution for you. Your doctor visits in the hospital, when the doctor sees you while you're in the hospital, whether you're inpatient or outpatient, they bill under Part B. So remember I said you were in the hospital inpatient, you might actually end up having to pay more than $1,408 because the doctor is going to give you a separate bill billed under Part B. Also, 100% of most preventable services are covered under Part B, as long as the healthcare provider accepts the assignment. So if the healthcare provider decides the amount Medicare bills them is what they will accept, you can have preventative services 100% covered. Basically, medical coverage is determined by federal and state laws. There's national coverage decisions and local coverage decisions that determine if something should be covered by Medicare. Now, there is this thing called excess charges under Part B. 42 states allow doctors, surgeons, and specialists to bill 15% above the Medicare approved amount for medical procedures. Illinois happens to be one of those 42 states. About 5% of providers nationally charge for these. Mostly they're specialists that add this charge. You are responsible for this charge. To avoid this, you need to make sure that the provider accepts Medicare assignment, not just accepting Medicare. So if they assure you they accept Medicare assignment, especially if you see it in writing, you should never have to pay an excess charge. I'll give you an example of what could happen. Let's say there's a procedure that's coded and Medicare says they will pay $3,000 to the practicing surgeon to do this procedure. This practicing surgeon lives in one of the 42 states and decides he's going to charge 15% above that. So you get to add $450 to the bill. Now your Part B is going to cover 80% of the allowable amount. So it's 80% of $3,000 and that comes to $2,400. So you have to pay $600 of that $3,000 plus the $450 that the excess charges. I'm also assuming you already met your deductible or you got to add $198 to that also. Now the good about original Medicare, Parts A and B, you have a lot of choices in doctors and hospitals you are allowed to use. These plans can't shut down or leave town. So you sign up for Medicare A and B, you have Medicare A and B, you don't have to worry about it leaving unless the whole government, something really changes there, and then we have more things to worry about than our healthcare. You do not need referrals to see specialists. So you want to see a cardiologist or a gastroenterologist or an ophthalmologist, you do not need to get a referral from your primary care doctor to do that. The premiums are set by the federal government. So the marketplace, you don't have to worry about a free market economy or some company deciding to overcharge you for these. The government sets these. And coverage is not limited by your local region. Some plans, depending on when you move, may not be available when you move or if you travel. But in the United States, Medicare is generally a nationwide plan. The not so good about original Medicare. Most medications are not covered. So you have a condition called AFib. You can go see your doctor and have your doctor's visit paid at 80%, but they want to put you on a medicine like Eliquis. If you do, it's not covered and it has a cash price that's a little over $450 a month. The co-pays or co-insurance could possibly break your budget. 20% of an observation stay may be more money than you have budgeted for that balance you have to pay a hospital. Medicare does not have an out-of-pocket spending limit. So technically, if you have really bad luck, you could end up spending a whole lot of money out of your pocket with no limit to the amount you could spend in a year. A lot of people add a MediGap or a supplement plan, and plus that Part D plan to cover your medications are often added, and then you have to pay separate premiums for those, and that could result in some people a fairly high monthly premium. And now you have separate plans for medications and a supplement. You have some added complexity of not only do you get the Part B premium taken out of your Social Security, you have two other companies that might be taking money out of your Social Security plan. Now, supplemental insurance or MediGap. This is for people who have Medicare A and B and want to purchase it. Basically, you may enroll in this, and it's a 6-month window starting when you are 65 and enrolled in Part B. The monthly premium is paid to a private insurance company, and you still got to pay that Part B premium to the federal government. Companies that do sell plans must always offer Plan A. Here's one of those alphabets again. Not Part A Medicare, but Plan A. They also, if a company is going to sell one of these plans, they have to sell a C or an F plan, and I won't be surprised if that verbiage gets changed to a D or G plan. If they won't offer any of those plans, then they can offer other plans in addition. What these help you do is pay some of the healthcare costs that original Medicare did not. If you have a co-payment, co-insurance, deductible, often these can be paid for by a MediGap policy. So that $1,400 deductible for an inpatient hospital stay, a lot of MediGap plans will pay that for you. Some plans also cover some services that original Medicare would not. Like some cover healthcare when you travel outside the US, usually 80% coverage if you travel in a foreign country and need medical care. Basically, in today's world, you can buy an A, B, C, D, F, an F high deductible, a G, a K, L, M, and N plan. If you already had a J plan, you may continue that. That's a grandfathered plan. And actually, the F plans are becoming grandfathered. And I expect the G will also have a high deductible option for consumers when that happens. There's also what they call select plans, which have approved networks. And if you leave that network, you have to pay 20% of the cost. Often the advantage of a select plan is you have a lower premium than a regular plan, but you now have a network of providers. Plans A, B, K, L, M, and N generally have more out-of-pocket costs for services, although N is a pretty interesting plan I'll talk about a little on its own. C, F, and J plans all pay the Part B deductible, so you don't have to pay $198 to start the calendar year if you have the C, F, or J plan. C and F plans will not be available for new customers starting this year, so if you are eligible for Medicare starting this year, you may not get a C or F plan. If you were eligible for Medicare last year, but you were still employed and chose not to enroll in Part B till this year, because you were eligible last year, you could still buy an F plan this year. F, G, and J plans also paid the Part B excess charge. So that 15% that specialist charged beyond the Medicare allowable amount, the F, G, and J plans pay that. So that $450 will be paid for by this plan and not out of your pocket. The F high deductible plan generally pays 100% of cost after you meet your deductible. The 2020 deductible was $2,340. But the high deductible plan is the cheapest premium of all the Medicare gap plans, with a policy ranging between $31 to $91 a month. The regular F plan is about $111 to $294. And a lot of the other plans maybe have a premium as low as $53, and some have a premium that starts at about $109 a month. And some of these premiums can go up to like $314. G covers exactly the same as F, and D covers exactly the same as C, with one exception: you have to pay that Part B deductible, or $198, before these plans kick in. Generally, these plans, though, cost $4 to $76 less per month than the F or C plan that you could buy in place of. A good rule of thumb: if you can buy a G plan for less than $16.50 a month less than an F plan, you will actually save money in a year. So in other words, if you are paying $16.51 more for a Part F premium than you would be a Part G premium, you're actually losing money. You'd be better off paying for the Part G and paying the premium to start the year. There's a lot of rumor that there will be a G high deductible plan to replace the F plan. Every time I look, I haven't seen one yet, but every literature I read says they're coming. Now I'm going to talk about some significant plan differences. Plan A does not cover the Part A deductible. So if you choose to buy Plan A, you still have to pay that $1,400 for an inpatient stay. And Part M only covers half of that deductible, so you'd pay about $700 deductible for an inpatient stay. Skilled nursing facility benefits are not included in Plans A and B. So what that means, if you need skilled services from days 21 through 100, you're going to have to pay that $176 copay, and your Medicare MediGap plan will not cover that for you if you have Plans A or B. Foreign travel emergency is not covered in Plans A, B, K, and L. So if you do travel a lot and you're looking for coverage and don't want to buy a separate rider, you might want to avoid these 4 letters as your supplemental plan. K and L have significant cost sharing, but they also put a yearly out-of-pocket limit. So if you have a K plan, when you have to pay 20% of what Medicare doesn't, or you have to pay that $1,400 deductible, K will pay 50% of it, and you have to pay the other 50%. L, you only have to pay 25% of that amount. And once you meet the out-of-pocket cap, then you don't have to, then it pays 100%. But keep in mind the true cap, you also have to pay the deductible. So that $29.40 I show, you have to add $198 to really show what your true out-of-pocket is with the L plan. N normally covers very well for labs, tests, observation stays, the inpatient deductible. Those are generally paid at 100%, they pay 100% of what you owe. But if you go see a doctor, you usually have a copay that is up to $20. If you go to the emergency room, you have a $50 copay that they will waive if you are then admitted. But the premium difference of the N plan, they run between $87 and $176, and I'm using Lee County for these numbers. Ogle County may have different prices. Whiteside County also may have different prices. So the deductible isn't really there. It's a copay for office visits in an ER, and the premiums are actually very competitive. I don't see a lot to make me want to buy a Part A plan over a Part N plan when I look at the premiums in the area and what Part N covers that Part A or Plan A doesn't. Now, Plan J, if you had it, also has this thing called preventative care that they help pay $120 with a year, and I don't really know what that is. You would have to read your policy. They also help with at-home recovery, where they may give up to $1,600 a year to help while you're recovering at home from an illness. And that would be beyond what your Medicare skilled benefit would provide. A lot of J plans also cover prescription drugs. The bad news is Plan J owners are starting to get really unhappy because their premiums are rising considerably because the pool of people that have Part J plans is getting smaller and smaller as people are no longer around to receive Medicare. Something I think people should really consider is the high deductible F plan if they like what the F plan has to offer. Plan F could cost a person up to $3,528 a year in premiums. The high deductible plan could cost up to only $1,092 in premiums. I don't know why I say only, that still sounds like a lot to me. That difference though is $2,436, which exceeds the high deductible of the Part F plan. So every year, even if you have a lot of medical expenses and you have to pay the full deductible before your Plan F high deductible kicks in, you're still $96 ahead. If you have very little expenses that year, you got a lot of premium savings that you're able to keep in your bank account. I would recommend if you're ever going to consider a Plan F and you're planning ahead before you're Medicare eligible, to get use a healthcare savings account and try to put about $5,000 aside to cover your deductibles for about 2 years. And when you have to take money out of it, when you do have the Plan F high deductible, when you have to make some payments, replace that money out of your premium savings so you always have this cushion sitting there. If you have about 3 or 4 really good healthy years, you're going to start having some extra money in your pocket that you would not have if you just had the Plan F. I would anticipate when the G high deductible plan comes out, you are also going to have a similar difference. One thing I will tell you is my insurance agent, when I called him, who sells my home and car insurance, and asked him about the supplement plans, he said he actually really supported the regular Plan F. He says if my customers are happy with their monthly premium, they know everything, that 20% or the deductible for inpatient stay is covered by the Plan F. If there's an excess charge from them, someone charges, it's covered by Plan F, so they know that, hey, I balanced to pay my premium and I have no worries for what Medicare will be paying. I'll give you some good news about the supplemental insurance from MediGap. It covers some or most of out-of-pocket expenses that Parts A and B don't. If you enroll during the initial enrollment period, you are guaranteed coverage, even if you have a pre-existing condition. And that coverage is then guaranteed renewable as long as you pay your premiums. It's nationwide. So if you buy, unless you buy one of those choice plans, if you buy a plan here and you travel to California to visit and you're hospitalized, and so it's an inpatient, so Medicare is going to pay for your hospital stay. You don't have to worry about that $1,400 if it was covered by your supplement plan because it travels with you in the nation. And the plans are standardized by the federal government, so it's really easy to compare plans to each other to see the differences. And when you want to shop for a Part N plan, you can just look at what insurance company you like the cost of, and it may be a company that you know is going to be around too for a while, but you can actually say anyone who supplies an N plan, they all match. So it's not like State Farm, if they sell an N plan, is any different than MetLife's Part N plan. The not so good about MediGap plans, the cost. The average premium of these is over $2,000 a year for people who had MediGap plans. They looked at the average premium Americans paid. They spent over $2,000 a year. Keep in mind, you're also spending $144 to have Medicare Part B on top of this. And the costs can range, so if you want to look for monthly, $31 up to $357 per month. So that's looking at, if you buy the cheapest Part F high deductible plan, you pay only about $372 per year. If you have the most expensive plan out there, you could be spending over $4,000 a year. Overall, when I looked at these plans, plans A, B, and C tend to have high premiums compared to the benefits you receive, which means you can usually find another plan that has similar benefits at a lower cost or much better benefits at the same cost. Once you're enrolled in a particular plan and letter, it's very hard to switch. So if you decide, I'm not going to need the hospital early, so I don't care about that Part A deductible when I go to the hospital, so I'm going to pick Plan A. As you get ill or you age and you realize, I might need to start going to the hospital once or twice a year, I should switch plans, you may not be able to switch letters. So I always tell people, choose wisely when you pick your initial plan. Think long term. Also, if you do not enroll during the initial enrollment period, plans can deny coverage or charge higher rates. I've met some people who could not get an affordable MediGap plan because it was 10 years after they were eligible. So the premiums were too high, and a few people were actually denied for pre-existing conditions. The other bad part about this is you still need that Part D plan to cover your medications unless you happen to have Plan J. I'm going to talk a little bit about guaranteed issue rights. Pretty much, you have a right to buy a MediGap plan A, B, C, F, K, or L that is sold in your state by any insurance company if any of the following apply to you. So this can get you away from those denials or a higher charge for pre-existing conditions. You were in a Medicare Advantage plan. That would be a Part C plan, which I'll be talking about next. And it's leaving Medicare, meaning it's not going to be serving your area anymore or providing a Medicare plan. Or you move out of the service area that Medicare Advantage plan served, or the plan itself didn't follow the rules and highly misled you. You could leave your Medicare Advantage plan and be eligible to buy a MediGap plan without the denials. Your Medicare insurance company goes bankrupt or didn't follow the rules, you may buy one from another company if that happens. If you lose MediGap coverage through no fault of your own, not really sure how to explain how you can lose something at no fault of your own that isn't described here, but I guess if there's another reason they think you had no control over this that wasn't specifically directed in here. If you had a select policy, but you moved out of that service area, you can then buy a Medicare Gap plan, or you can buy a select policy that serves that new service area. If you have original Medicare, and then you had employer union coverage that was picking up what Medicare didn't, so you didn't sign up for, you didn't buy a plan, you didn't sign up for Part B or buy a Medicare plan when you had Medicare A because your employer was providing you additional coverage. But say that coverage ended or your spouse retires and the coverage you got through them is no longer there, you may purchase one of these plans without having to worry about the higher premium or pre-existing conditions. But you must purchase that plan no more than 63 days from when the policy you're replacing ended, or the date you found out if for some reason you didn't realize your spouse quit their job and you no longer had coverage, and it was first time you went to go use your health insurance and it was 9 months later. If for some reason they didn't tell you, you have time. The guaranteed issue trial right, You can also switch to your previous MediGap policy if you decide to switch back after trying a Medicare Advantage plan or select policy for the first time and you've been in it for less than a year. So you leave traditional Medicare to go to a Medicare Advantage plan. You see them advertised on TV, especially right now. And you decide after 6 months, hey, this plan is not as good as they said it was going to be. I want to go back to traditional Medicare. You can go back to your previous MediGap policy, no questions asked. Now, if you stay in that Medicare Advantage plan for a year and a month and change your mind, you actually may not be able to get your original plan, and you may not be able to get a MediGap plan at all that you can afford. Once again, you have to sign up 60 days before or 63 days after that particular policy ends. But if now there's another catch. You liked your MediGap plan, but you tried an Advantage plan. 9 months go by and you want to switch back, but that original plan is no longer available. You may choose an A, B, C, F, K, or L plan if you want a MediGap plan. If the following occur, you join a Medicare Advantage or PACE plan when you first were eligible for Medicare at 65 and decide to switch back to original Medicare. So you, at 65, chose a Medicare Advantage plan. 2 years go down the road and you're thinking, this plan is not for me. I want to go back to original Medicare, get Medicare A and B. You may get a MediGap policy sold in your state under that condition. Once again, you got to do it 60 days before that other policy ends or by 63 days after. Part D, we're going to go to medication coverage. And this is, if you want it, you have to sign up for it. And I recommend that you should sign up for it, because if you don't sign up right away, the premium penalty can really make a huge difference later on. Basically, it's 1% of the national base beneficiary premium, which the government decides what that premium is. It was $32.74 this year, times the number of full months you were uncovered and did not have credible coverage. I met a gentleman who did not sign up for Part D. I met him, he was unable to afford his insulin. He said, well, my brother has this great plan that pays for his meds. His brother signed up for his plan right away. And so he goes, and his brother had dementia, so he now took over managing his brother's health care and plan. So he goes, well, maybe I should buy the same plan my brother has. So I said, okay, I helped him do that. He had to pay 30 more bucks a month for life for the same plan because he waited that much longer to sign up for it. It's still, for him and his insulin costs, still put a lot of extra money in his household, but $30 a month for life and a premium difference, that's a pretty steep penalty. The coverage gap starts, this is another thing about Medicare D, it has a coverage gap, or what they call the donut hole. Once $4,020 are spent by you and your drug plan, you enter the donut hole or coverage gap. You get to leave that gap once $6,350 is spent by you, or the total drug cost goes over $97.19. And then you go into catastrophic coverage, which has a much lower cost of medicine than the donut hole and often what your initial copay was. If you qualify for extra help, you don't have to worry about a late enrollment penalty, and you also do not have to worry about the donut hole. Other credible coverage includes, if you have a Part D plan and you want to switch during open enrollment, you had credible coverage. If you have a Part C or Medicare Advantage plan that offers prescription coverage, that's credible. Or you have credible prescription drug coverage like through an employer. A lot of people sign up for Medicare, but their spouse is still employed, so they don't get a Part D plan because they can get meds covered under their spouse's employer plan. As long as you, when that plan ends, sign up for Part D, you don't have to worry about a penalty premium. Plans can vary on premium cost. I've seen premiums in this area as low as 14 bucks a month. I've seen premiums go over $130 a month for Part D in this area. The drugs they cover, there's formularies, so certain medications may be covered by one plan and not the other. The cost of medications, those can vary. So you may have a copay of $47, you may have a copay of $30 of a covered medicine. Your generics may have a copay as low as $0. They often have a deductible, and the deductible may be different from plan to plan. The majority of plans this year have a deductible, which is set by the government to be a maximum of $435. Most of the plans in this area have a $435 deductible. I've seen one in the $365 range, and I've seen a few have no deductible, but the premiums are sky high for those plans. And then copays are based on tiers in a drug formulary. Tier 1 has the lowest copay, Tier 2 has the next, Tier 3 okay. Tier 4, generally you're going to be paying 40% of that drug cost until you hit the donut hole. Choice of pharmacy can also affect the cost you pay. So if you have a favorite pharmacy, you might want to find a plan that would allow you to continue to use one and get the maximized savings. Plan availability also varies by counties. If you do qualify for the low income subsidy or extra help, they can help reduce your copays or deductibles on these plans. Pretty much there was a rule came into place this year. After you've met your deductible, you can pay no more than 25% of a covered brand name or generic drug in the coverage gap. So in the donut hole, you will pay no more than 25% of what the accepted cost of that drug in your plan is. Potential savings, this is an idea for people to look at when you are shopping for a Part D plan. I recommend using the Medicare website, medicare.gov, and looking at Part D cost. And I have it, I'll put in my drugs, and I say put in your brand names, your generic drugs, unless it's a rare one like Lovenox or some hormonal creams or lidocaine patches, generally aren't very costly. So to save time, if you were on Eliquis, you can just type in Eliquis, compare plans, and then you can sort it where it shows adds the premium, your deductible, and the copay for Eliquis, and sorts it by how much you're going to pay out of pocket for the year with all those added together. I met a patient who was paying $73.60 a month. He had a $435 deductible. Total cost for those 6 medicines for the calendar year would have been $2,876. I looked at 2 other plans with him that had premiums that were down to $2,280 and $2,520. Still had a deductible of $435. But based on the premium difference alone, he was saving between $580 and $610 a year. The cost, including adding the medication, was $1,484 or $1,600. So he literally could save $1,200 to $1,400 by switching plans in 2020, which he did. He had to switch from, if he wanted to get the best savings, he had to switch from Walgreens to Walmart. I think he chose to keep Walgreens and only saved $1,200 instead of the $1,400. Another example, Basaglar and insulin. There were 3 plans in 2019. SilverScript Choice had a $26 premium with no deductible. That plan now has a $365 deductible. 2 years ago, it was too good to be true, and it was a great plan for people who had it. Blue Cross Blue Shield cost more per month and had a deductible that year, and then there was a Cadillac Blue Cross Blue Shield plan that had no deductible but had a really high premium. And then depending on the pharmacies, you were better off using Walgreens for Blue Cross or Walmart for SilverScript. But a person signing up the end of August has 3 months of this plan to finish his year. SilverScript would have cost him $202 for those medicines and his premiums. And if he would have, through mail order, if he would have done Walmart, $224 and added about $22 more he went to Walgreens. The basic Blue Cross plan would have cost almost $700 versus the $202. And the premium plan, Basaglar, was not in formulary, so it would have been really, really expensive. So if you had a premium plan, instead of Basaglar, you would have wanted to been on a different medicine, a different insulin like Levemir. For the whole year, if someone would have signed up for that plan in the beginning of 2019, they would have hit the donut hole in the SilverScript plan in December and had to pay $90.95 for his drugs instead of the $28.80. The Blue Cross Blue Shield would have had to pay $108 in December, but you notice they were also paying the pharmacy a lot more money up until December. The Blue Cross Blue Shield plan was paying the pharmacy $400, but if they would have switched insulins, that would have dropped a lot. because we changed it to Levemir, that expensive Blue Cross Blue Shield plan only paid $2 a month from January to August. No deductible, that's how much they paid the pharmacy for their medicines, was $2. Once August hit, they had to go up to $107. And then September, they paid $119 till the year ended. But still, when you add the premium cost, you were still paying almost twice as much as the SilverScript customer because you had to pay over $100 more in premiums. I'm going to show an example if we added Eliquis to this patient to start the year. He now has 2 brand name drugs applying to the donut hole. He actually met the donut hole in May instead of September. He hit catastrophic coverage in October. So the SilverScript customer was paying about $80 through April, and then $265 in May, $234 through September, down to $119 in October, and then $55 for the rest of the year. And the Blue Cross Blue Shield plan was much cheaper early, $32, but then jumped up into the $222, $231, and at the end $207. So if you're on multiple brand name drugs, the donut hole is going to find you fast. You can actually often get help from the manufacturer by typing the name of the brand name medicine, going to the manufacturer's website, asking for patient assistance. Insulin users this year, if you just tell them you can't afford your medicine and you make less than 400% of the poverty level, these companies would send Part D customers their insulin free for the rest of the year. A lot of them want you to pay so much money out of pocket. Because of COVID, they dropped the $1,000 out of pocket minimum spending. We're going to talk about Part C, or the Medicare Advantage plans now. These are the ones you see on TV all the time. Joe Namath talks about how you can get meals delivered, dental, eye care. Yes, a lot of that can be provided. This is provided through a private insurance company and not the government, but these plans are approved by Medicare. Many of these also have prescription drug coverage, but some do not. They are an HMO or a PPO, so if you're familiar with those from any work employer, you now have a network of providers. So you may not be able to see a certain provider under these plans. You also usually need pre-authorizations for specialists, tests, or services. So you may not be able to go see the cardiologist without your primary care provider giving you a referral. A lot of tests require a pre-authorization under these plans. So there may be a delay for you to get an echocardiogram until the insurance approves it if you want to be sure that it's covered. Medicare Part A and B, if the doctor ordered an echocardiogram, you do not need prior approval. MRIs are a test that are starting to need prior approval for Part A and B, but most tests do not. These are also tend to be regional, which means if you travel, you may not be able to get network coverage when you travel out of your area. Snowbirds have to be really careful, and some have to buy a special rider on a plan so they can get coverage while they're down in their southern state for the winter. Some of these pay your Part B premium for you. So some of these are, you don't even pay the $144 to the government, and some you still have to pay that. So some people like these plans because they don't take any money out of their Social Security check. Usually they have co-pays, deductibles, and co-insurance responsibilities. I will tell you, an inpatient stay, usually you have a co-pay from days 1 through 5 in the hospital. That's usually around $350 to $370. And some actually then have a co-pay for days 6 or 7. 350 times 5 is more than the Part A deductible if you did not have the Advantage plan. They do have out-of-pocket caps in place, usually between $6,000 and $8,000, so you know you can't spend more than that on health care if you're in network using these plans. They also offer services that Medicare, original Medicare does not offer, much like eye care. Keep in mind, Medicare Advantage plans may offer something in Ogle County that Lee County patients cannot get, or vice versa. So a lot of times these additional services vary from where you live. One thing nice about them is it's one-stop shopping. If you buy a plan that has prescription drug coverage included, you don't have to worry about a MediGap policy. You don't have to worry about looking at multiple sites and getting multiple policies. Also, if you have a Medicare Advantage plan, no one is allowed legally to sell you a MediGap policy you don't need to take advantage of you, unless you were choosing to go back to original Medicare and you go to them saying, I'm going to drop my Advantage plan, then they can sell you that MediGap policy. So if you have a Medicare Advantage and someone does sell you a Medicare Gap policy and you end up paying that premium, you have legal recourse to get that money back. A lot of these, your primary care provider becomes your coordinator of your health needs. Nice part is he's involved in the loop of everything that's going on. The bad news is you have to get in touch with them to keep them in a loop if you do want to see a specialist. Often there's lower cost sharing compared to original Medicare. People who really should look at the Medicare Part C plan are people who make too much money to get help from the government and cannot afford the premiums of Part A or B. Or you didn't realize you needed Part B, and 10 years later you're trying to sign up and realize you can't afford to do so, and you can't afford to continue to pay 20% of your health care cost. These are the people who should be shopping for a Medicare C plan. If you can comfortably afford supplemental insurance and a Part D plan, I think the choice you get from having Medicare A and B, I think trumps what the Advantage plans have. Here's the not so good about these plans. They have higher out-of-network cost. So if you leave your network, you're going to pay a higher cost, where Medicare in the United States doesn't have a true network. You may need referrals for specialists, and this plan could shut down or leave the area. So you have a dynamite plan, you're happy with it. Next year, it may not provide that plan in your area, or it may change its rules and decide to no longer pay your Part B premium where it did the year before, or change the medicines in its formulary. These benefits, coverage, and deductibles can change every year. They're not set by the government. Some actually charge above the Part B premium, so you pay the $144, plus you have to pay so much money to have these plans. They're also very difficult to compare to each other because no two plans are the same. So it's not like I can compare Medicare D plans to each other. It's almost impossible. You almost have to read each policy to see what they offer. You can compare the premium cost and what your med costs are with the Medicare.gov helper, but you can't look at all the other details. They can also deny services that you would normally get under traditional Medicare. For instance, you had some surgery and you're in the hospital for 4 days as an inpatient. You and your doctor and family realize you should have rehab and go to a skilled nursing facility. If you're a Medicare Advantage person, they may deny that and insist you can go home and they won't cover that nursing home stay. Whereas Medicare Part A people that still had a skilled need, they're not denied by Medicare and they could go to that skilled nursing facility and get that care. The other thing is they may choose the facility they will allow you to get care at, so you may not be able to choose your nursing home for skilled care. They may say you can pick this one or this one. I've seen some that have a network one that's in the suburbs, and so now you have your 90-year-old spouse. If they wanted to visit you, they would have to drive from out here to the suburbs to see you, which doesn't seem very practical. Also, once you're in a Medicare Advantage plan, if you choose to leave it, it can often be difficult to get MediGap insurance at an affordable price if you just decide to go back to original Medicare. So while they offer a lot of great things and they sound great in the commercials, I do think there's some buyer beware because you're losing some choice here. We're going to talk a little bit about some of the additional help that is out there for people on Medicare. Obviously, Medicaid for people who qualify, but there's also Medicare saving programs or MSPs that are federally funded and administered by the state, and they can help pay some of the premiums, deductibles, or copays. And you apply for these via the state Medicaid program. And then there's extra help, which helps with Part D cost. That is applied via Social Security. They actually automatically enroll you in this if you are in some of the programs listed above. Basically, Medicaid, if you're 65, disabled, blind on Medicare, and you're below 100% of the federal poverty level, you can qualify for Medicaid. If you're under 65, you can make up to 138% of the federal poverty level. And there's some areas where that number can actually go a little higher if there's a high cost of living in certain areas. They also allow you to have some assets. Single adult can have up to $2,000 in assets to qualify. And they show some exempted assets. Your primary home, If you have a vacation home and a primary home, you probably shouldn't qualify for Medicaid because I'll bet your second home is worth more than $2,000. There's also a waiver to help protect your spouse in Illinois that there can be up to $109 for some assets for a spouse if you're applying for long-term care Medicaid to go to like a nursing home. The qualified Medicare beneficiary programs, they help pay part of the Part A and B premiums, deductibles, and copays. If you have one of these, Medicare providers are not allowed to bill for services and items, including deductibles, coinsurance, and copays, except for certain outpatient prescription drugs. But you must notify providers you have this program. So pretty much, you have this program, your provider accepts Medicare, you show this to them, that 20% you're supposed to pay them, you do not have to pay. Pharmacists may charge a certain fee up to $3.80 for prescription drugs covered under Part D with these plans though. So you may be able to get a brand name drug for $3.80 where it would normally cost a person $47 copay. The monthly income limits are on the slide. And if you work, you may be able to have a higher income limit. So if you get Social Security and we also work, that may bump your income to qualify. There's a specified low income benefit, only helps Part B premiums only. Once again, they're based on income limits. And if you're working, I recommend contact Social Security. If you're working and you make more than $12.69, you might still qualify. Qualified individual programs, they help pay Part B premiums only. You have to apply every year to get these, and they're granted on a first come, first served basis. So when the money's gone, if you didn't get it, you're out of luck. If you had it the year before, you do get the jump to the front of the line. If you qualify for Medicaid, you do not qualify for this, but Medicaid's going to help you probably more than this program will anyway. Qualified disabled and working programs have some similar things to help pay the Part A premium. You notice the income goes up quite a bit on these. You can qualify if you're working disabled under 65, you lost your premium-free Part A when you went back to work, or you're not getting medical assistance from your state and you meet the income and resource limits required by law. Extra help. This is your Social Security. It can help with your cost, monthly premium, annual deductibles, and prescription copays related to your Part D or Medicare prescription drug plan. People who qualify save about $5,000 a year in medications. For starters, there's no donut hole. Not all Part D plans allow you to use extra help, but if your plan didn't and you qualify, you can switch plans without open enrollment. Individual income, $18,735 a year, and your resources have to be under $14,600. There's some other circumstances you may be able to get help over that income. Contact Social Security to find out for sure. You can apply for this at Social Security website online, even from your computer, and find out if you get it or not. Other resources you can tap into to help you with the Medicare questions. The State Health Insurance Assistance Program, otherwise known as SHIP. There's website link and a phone number. Senior centers like the one across the street from where I'm sitting, they help people with these. A lot of insurance agents will help you with this. Keep in mind, they might be trying to also sell you their MediGap plan since you're in their office, so there might be a little pressure. AARP has a lot of resources and guidance to help you learn about this. Some of those you have to be an AARP member to get those resources. Medicare.gov is an awesome website to go over this, or calling 1-800-MEDICARE. There's probably a hold with that. Social Security and public aid offices are also the other resources I would suggest tapping into if you have more questions. I want to thank you so much for attending this presentation. Hopefully you were able to get something out of it. And if there's any questions, they are being directed my way. And it sounds like there were not any. Thank you so much.
All right, thank you, Jason, and thank you everyone who joined us tonight on Zoom and Facebook Live. So if you have any additional questions afterwards, leave them in the comments below. We'll make sure to get it to Jason. If you want the presentation, send us a private message and we'll make sure to get you the presentation. Also, there's a lot of good information in there. So again, thank you and good night.